Do you get vertigo and neck pain? So we have a comment here from one of our other videos from someone saying that they unfortunately have been having CTs, I believe that would be MRIs potentially, and they've already had scans. The doctor says that they have vertigo. That could be positional vertigo if it's PP. Around 7 weeks ago, it's eased slightly, but they're still feeling giddy and they have neck pain and wondering what's causing it. So for vertigo and dizziness, actually I'm writing a book about this at the moment, there are lots of different potential causes. However, dizziness is something which is a bit more of a wide spectrum. Vertigo is usually much more of a spinning sensation, and usually there are some things which are much easier to identify as being the causes for vertigo. Of course, there can be some cases which are a bit more difficult, but usually they're going to have something a bit more obvious, whether it's something like BPPV, or maybe it's something like, say, labyrinthitis. These are very specific pathologies. Dizziness can be a bit more widespread. It's a bit more of a spectrum, and there can be many different causes, so it needs more of an investigation. If the doctors, in this case, it seems that it's already sent for a CT, and potentially, again, it says HMI. I'm not sure if that's a different type of CT, or maybe it's supposed to be an MRI. If they've already sent for these tests, what they're most likely looking for is excluding anything big and scary. So these are what we call red flags. So they're excluding things which may be like growths, it may be like something they expect in the blood vessels, something which may be a contributing factor, which may be causing this as a primary or a secondary issue for the vertigo and the giddiness. So they're trying to basically exclude that first to make sure everything is safe. In these cases, though, it can be normal that someone may have vertigo and may have this residual giddiness afterwards. If that is the case, it may potentially be something happening in the vestibular system, the visual system, or the proprioceptive system. So that's where the proper doctor will be able to assess and give more of an idea of what's going on. However, if in this case we see a mix of vertigo or giddiness / dizziness, because giddiness and dizziness would be quite similar, and there's neck pain, then we would start to suspect that maybe it's something that's happening in the top parts of the neck, which may be a contributing factor towards what's happening with the dizziness and the giddiness. So the top part of the neck is part of what we call the proprioceptive center. So this essentially is how your body can know where it is in alignment due to small sensors we all have in parts of our muscles, ligaments, tendons, and joints. So if your body is able to detect things well, then we should have better balance. But if some of those detectors are slightly off, maybe because we have an aberrant posture, maybe because things have been shifted in our joints, then it's going to start to send the wrong information up to the brain, which will correlate with what's happening with the eyes, what's happening with the inner ear. And all that information gets put together, but it says, wait, the information from the joints is slightly off. So then the person starts to feel more giddiness, more dizziness, or in extreme cases, there can be this vertigo. Because there is this off, it also means that locally it's more likely to be affecting things like what's happening with the dizziness, and it can be, with